Hello there, it is Woman O'Clock, and I would like to say welcome to the 40+ Woman with Busola Jegede. The 40+ Woman is an informative program, very inspirational. It is something that every woman needs to pay attention to. On today's program, we have an interesting topic, a needed topic, something that every woman needs to know about. And I'll be introducing our guest in just a bit. Don't go away, I'll be right back. Hello there, my name is Busola Jegede. I am a John Maxwell certified coach, a consultant, and a chartered accountant. For over 15 years, I've been working with women, helping them to discover their purpose, their vision, holding their hands, seeing them through turning their visions to profitable ventures. And it will be a delight to work with you. Do you feel unfulfilled? Do you feel that there is more to your life? Do you have a story to tell, a book to write, a vision to birth? Are you over 40 or 50? I can assure you that the second half of your life can be better than the first half. Why don't you sign up for my one-on-one coaching session or a strategy session? It will be a joy to work with you to reinvent yourself, to birth a new you. Welcome back. Now on the 40+ Woman, we are talking health. Like they say, health is wealth. And no matter what you have as a woman, look at so many women laboring in their families, laboring over their children. You want to be healthy so that as you grow older, you can enjoy all these children and enjoy the fruit of your labor. That is why it's important for us as women to pay attention to our health. Typically, a woman will take care of everybody, and most women don't take care of themselves. When people are sick in the family, they make sure they take them to the hospital. But when the woman is sick or she feels a little pain, she prefers to manage because she's so busy taking care of everybody else. If you're 40+, you need to change that. Self-care is very important. And more so, you cannot avoid paying attention to certain red flags that you may see as you grow older. On today's broadcast, we have a medical doctor with well over 15 years experience. Today on the 40+ Woman, it's my pleasure to bring to your spaces, your homes, Dr. Ifeoma Izeoma.
Thank you.
Doctor, you're welcome.
Thank you very much for having me. It's a pleasure to be here today.
Now, a doctor, you're also a 40+ woman.
Yeah.
So you're not just speaking as a doctor, you're speaking as a woman who knows the issues that are on the table.
Yeah.
What are the red flags that a woman should never ignore as she grows older?
Yeah. Thank you very much. There are a lot of red flags a woman shouldn't ignore as you get older. 40 years is a very critical time in our lives as a woman that you really, as you already said, you have to really take good care of yourself so you'll be able to take care of others. We'll start from the breast. Of course, we will know about the breast cancer, which is one of the most leading cause of death in women. And it's something that it has a very good prognosis as far if you start detect it on time with chemotherapy. Most people usually do well with it. So you start with the breast examination. When you look at your breast and you're seeing that the shape and the consistency of the breast is not like it used to be, or you find lump, which is the most common presentation of breast cancer. You find a lump on the breast, or you find a lump, a mass on the armpit area, is a red flag. So then the nipple retraction, you see the nipple going inwards instead of the nipple pointing out, is also a red flag. Then another thing that is very important that we should really pay good attention to is unexplained navel bleeding. When you see that you're bleeding through the vagina, especially for the postmenopausal women, when you've already stopped menstruation, and then you start seeing that you're bleeding, or even at premenopausal, you're seeing that you're bleeding in between your period, or you're having something abnormal bleeding that you don't used to have, is something you should really pay attention to. Then postcoital bleeding, you're not supposed to bleed after coitus, is also a red flag. Then another important one is foul-smelling vaginal discharge. Yes, you usually have the vaginal discharges, but not a fishy foul-smelling discharge that you see it is coming out so much like you didn't expect it to be. So it's something you really have to pay attention to. Then the pelvic pain is something you shouldn't ignore, because some of the ovarian cancers, that's how it presents.
Pelvic pain, that's
lower back pain. A lot of people complain, I've been having this back pain for a long time, and maybe you think it's arthritis of the backbones. It's not. It's something you have to really pay attention to. Unexplainable weight loss, when you're losing weight and you're not dieting, you're not fasting, and you see yourself just drying up, is something of concern. So you really need to liaise with your doctor. You have to really go and meet your doctor immediately. Then another important thing is stroke. Sometimes you look at your face, wake up in the morning and you see that your face is twisted to one side,
like drooping.
You are drooping, your face is drooping, or the mouth is drooping, or you see weakness, of one part of your body. And one thing with stroke is that you have a timeline. Once you see it on time and intervene within 30 to 1 hour, you can still, reverse. Yes, it can be reversed. So it's something that you really have to pay attention to. So all these things are the red flags of the most common illness.
So let me just ask a quick question. Do some of these present with pain, or some of them, the lumps, are they usually painful? Or the swelling in the armpit, are they painful?
Yeah, sometimes lump might not be painful. Usually present as painless lump or mass within the breast.
So what you're saying now is, even if it is not painful,
even if it's not painful,
you should pay
attention to. And also even abdominal, sometimes pain, like ovarian cancer, as I said, can come with the back pain, low abdominal pain, or you can feel a mass. It's something also you have to. So sometimes it can come with pain, sometimes not pain.
So there you have it. The doctor has been telling us about the things we need to watch out for. It's a long checklist, and for every woman out there, we shouldn't ignore, especially when you're over 40. Remember all your investments. Remember all the school run. Remember all the school fees. Remember how you supported your spouse. Even if you're a single mother, you're working alone, remember there is a time for you to be rewarded, and that's why today's topic is very important. If you're a woman listening, you need to call somebody else to pay attention. So doctor, let's move on. Knowing that these signs, these red flags can occur, of course, as people of faith, many of us are prayerful. We take you to the Lord
every time,
and we believe for healing. We believe that the Lord, no matter your faith, I believe everyone, we believe that there is healing. But if somebody continues to see certain things, how should they respond? I know you can pray about it. That's what I'm saying. But in addition to that, what do you recommend that should be the response of a woman who has seen, probably felt her armpit, and she has felt something, and she's prayed about it, and then
I didn't disappear.
It didn't disappear. So what should she do?
Well, what you should do is first you go to meet your doctor. It's very important. So when you see your doctor, based on the presentation, whatever the presentation is, because we have, in medicine, we have different fields. So you go to your GP or your general physician that will now refer you to the specialist that will be taking care of that. So when you meet the doctor will do a lot of tests to confirm, because not all the breast lump are cancerous, to confirm whatever it is, and they'll go for the appropriate management and treatment.
So that seems very, very instructive. So in addition to when you're taking all this medical steps, intervening, if you're a person of faith, I would advise you still pray along, even as you're doing all this, and God will certainly give.
Yeah, definitely. There is nothing God cannot do, really.
Exactly.
Yeah.
So we're going to be back in a minute. We've been talking about the health concerns for the 40+ woman. And on today's episode, we have Dr. Isioma Ifeoma with us. She's still with us. Don't change that channel. We'll be right back.
Introducing Blissful Honey Beans. Rich in protein and fiber. Good nutrition for your family. Blissful Honey Beans. Hygienically packed in 2 kg and 1 kg packet. Stone-free and weevil-free. Pour straight to your pot and cook. Stress-free and convenient. Order online and it will be delivered anywhere in Lagos. For other locations, call 070-8307-6210. Blissful Honey Beans. No stress.
Welcome back to the 40+ woman, and we're talking health. Like you know, health is wealth. So we still have our guest with us, Doctor. Now, you have given us a list of red flags. What are the predisposing factors? What are the risk factors? What can lead to these signs appearing, so that when women know the things that are likely to cause this, then we'll know how to avoid them?
Okay, this is really very important. It's an important question, because if you don't know what are the things that can lead to something, you won't know how to avoid that.
Exactly.
So there are a lot of risk factors to that. Although generally for the cancers, we don't really know specifically what causes it, but there are some things that you see that you know that you are at a very high risk of having it. Like, you know, some runs in the family, there's a family history. If you have a family history of something like that, maybe anybody from any of your family members, you know that you're really at a very high risk. Then also age is also very important, especially that's why we are bringing this thing now, 40 years. Once you're getting to 40 years, you know, there are a lot of things, changes that occurs in the body, and that is also a risk. So obesity is really a high risk factor to a lot of illnesses. Obesity, yes. So we have to take care of ourselves, our weights. Obesity is a very high risk factor. Then also hormones, you know, some women, like we are discussing 40+, you know, postmenopausal, some people take on hormone therapy. Some hormones also predisposes one to that. Then
is it the hormone therapy they take, or
the hormone therapy they take? Yes, sometimes yes, it can. Even some drugs they use in managing other illnesses can also be put one to the risk of having some of these things we discussed, the red flags that we discussed. Then also the drugs we take, radiation when we're exposed to unnecessary. That's why we always tell people, you don't go for radiation, X-ray test and all this when it is not necessary. Yes, so you must be very, very important. You must be very, very important before you go and expose yourself.
Ordinary X-ray?
Yes, radiation, any form of X-ray, yes, it's really very, very important. So you shouldn't go if it's not necessary. So these are the things that puts one to risk. Then our lifestyle, some of the lifestyle we live, well, it's not common here, like people that smoke, that take a lot of alcohol.
It's getting common.
Yes, that's what I've seen. Yeah, a lot of women drink a lot now. Even smoke. If you go out now, you see them smoking. So these are the things that can predispose you to having all this. So yeah.
So there you have it. That enjoyment that can lead to a life of misery.
Yeah.
So risk factors are there. Is there something that we can do, like to enhance ourselves? Is there any kind of diet, although we're still going to be taking another session on that? Is there any kind of diet? Should we avoid sugary things? Do those things also affect?
Yeah, we have to. Our diet remodification is very important. Dietary, the diets we should be taking, we should take less of sugar. less of carbonated drink. We should take healthy diet like fruits, vegetables. You can't overemphasize the importance. It's really very, very important. Fruits and vegetables. We also should take healthy fats. The high density lipoprotein, healthy fat that has a lot of omega-3 fats that you can get from fish, mackerel, tuna, or sardine. So it's really very important. Healthy food is important.
So let's take this a notch higher now. We've spoken about the kind of red flags. We've spoken about the risk factors. Now, can we talk about the health checks that one can do regularly in order to find out these things so one can nip in the bud?
It will say that prevention is better than cure. So now we are talking more of preventive medicine, not curative medicine, because it's better you prevent something before you're caused.
Absolutely.
Yeah, you have daily checks that you do, simple ones that you can do in your room, in your bathroom, especially the breast examination. You must have to pay good attention to yourself, because you must be your first. You are the first doctor. It's whatever you bring to the doctor. You are your first doctor. So you must have to pay good attention to yourself. You know, you examine, you look at your breast. You should know how your breast looks before. You should know the normal before you now know the abnormal. So you have to assess your breast. You know, look at it and look. Is there any change in the shape, consistency? You have to take time to touch different parts of the breast, even raise the breast and feel it, know if there is any lump there. It's really very important.
Is it just by pressing?
It's not by pressing. No, there's a way you do your breast examination. I will do it in zones. You have to touch and feel for a mass. You know how you touch and you run around on it and feel. Touch your hands, axilla, your armpit. You have to raise it. There's a way. I don't know if I can demonstrate it. You raise it up and dip your hand inside it and roll it. You have different parts. We have different zones and regions on the axilla too, your armpits. So you have to really check both of them, take your time. It's just simple, but it's really very, very preventive. So another thing we are advocating is the pap smear.
Okay.
Apart from the pap smear, before I get to the pap smear, the mammogram is also very important. Yearly mammogram or maybe 2 yearly mammogram. You know, mammogram is a kind of machine that is like a kind of X-ray. I'll call it in a simple term that you understand. So you go to radiologists, they will know how to do it like an X-ray. They'll examine the different tissues. If there is any abnormal tissue, they will tell you. They have a way of doing that. I can't explain it.
So the mammogram is more extensive.
It's an extensive one. It's not as simple. It's not as simple as it is.
Because somebody may just be examining every day and think, okay, I don't need mammogram.
Yeah, no.
So you're saying in addition to your daily examination,
exactly,
at least once a year
or twice a year, you have to go for a mammogram.
Okay.
Yeah. So the pap smear is also very important. To check for any, so that once you detect any abnormality on time, as we say, the doctor will alert you, so you can start the management or the treatment. Then you also examine different, when you feel any pain, even touching your abdomen is also very important. Feel for masses, anything. Are you feeling anything that is not supposed to be there, or are you feeling any pain? So these are also the simple examination you can do.
Very important for us as women to pay attention to these things, make out time, and have a budget.
Yeah.
Many of us spend so much money.
We spend so much money on things that are not exactly.
And
our looks, but
when
crisis comes, that you must have to start early. Then also, as as we are mothers and we have children, as I always say, you have to prepare for this age early enough. It's not when you're 40 years you start running up and down with your lifestyle. And also for the girls, if you have girls in your house, you have to make sure they are vaccinated. We have vaccines now that prevent a lot of things, like for the cervical cancer.
Okay, vaccinate our young girls.
Our young girls, once they are 11 years, or once they are clocked 11 years. Although some countries start earlier than that, some start 9 years, but here in Nigeria, it start 11 years. So you give them 2 doses of the vaccine that prevents the human papilloma virus, which is what causes the cervical cancer. So you give them 2 doses. You start 6 months apart from the first dose they're already giving. Then, if the person is more than 15 years, then they have to take 3 doses.
Wow.
So even if you're not that age, you can still take the vaccine. So it's not restricted. There's no age restriction.
Okay.
So
any woman can take the vaccine?
Yes, most women that you are premenopausal, you can take the vaccine.
Okay. So you've got it there. Your daughters can be vaccinated so that they have a better chance, even if you miss the vaccination. Now, you've spoken about mammogram, you've spoken about pap smear. Are there other tests that a woman can also do, maybe to check her heart or vision or what?
Yeah, so you have to go yearly, go and see ophthalmologist for your sight, because this is also one of the common problems we have from 40 plus. Our sight usually will not be as it was before. Yeah, so you need to also go yearly to see the ophthalmologist to check for the eye pressure, to prevent glaucoma, because glaucoma is also one of the important illnesses that we also have.
And cataract.
Like cataracts, and because this glaucoma can even, I've seen some people that have glaucoma, they didn't know, and just can lead to sudden blindness. Yes.
Wow.
So it's really good to check our eye pressure. It's very important. Then the simple ones, even check your random blood sugar. And another red flag, when you're seeing a woman always you're weeing, diabetes is also a very common illness with us. So you shouldn't really...
Frequent urination.
Frequent urination. Sometimes you see that you're tired, you're panting. It has different presentations. Okay. So once in a while, also check your sugar level. You check your blood pressure is very important. So I advocate and advise every woman to have a SFIC. We have the electronic simple SFIC.
The blood pressure machine.
The blood pressure machine that you can use in measuring yourself, so it's also very, very important. So these are the simple ones you can do. Then also yearly, you can check, we have renal function tests that we can do. You have the liver. So you have to really check all these things. You don't need to wait for it to get deranged before you do something. So you make it a point of, duty to do that yearly, or do a thorough check on yourself. Yeah.
Wow, it's something that many of us need to step back and pay attention to the right things. As a woman, we want to be here, we want to be there, we want to look good.
Take care of everybody.
But have you spared time to go to the doctor to check yourself? It doesn't stop you from being a woman of faith.
Yeah.
Yes, we have to be careful about these things. Now, you've spoken about different health checks. What's the importance of sleep to a woman over 40? Because typically, a lot of people have insomnia, and many don't sleep for long, many don't sleep deeply. These things present as we grow older. So what's the effect of this on our health?
There are a lot of effects of not sleeping. That's why we shouldn't allow things to bother us.
Exactly.
Try and sleep very well. If they have any issue, you try. Now we are moving into mental health, because being healthy, we are talking about women's health. WHO describes health as a state of complete physical, social and mental well-being. Mustn't really be that there is absence of illness. So sleep is very important, because sleep can predispose one to depression, anxiety, high blood pressure. Even some of these illnesses that are there in the body, it also affects them. So it's important that every woman should take enough time and rest. Take a break from our busy schedule. Take a rest. If you think that maybe your environment is not so conducive for you, you must even travel abroad to have a good rest. You can get a very quiet place, just rent a small place, a hotel, whatever, just for 2 days and rest. Just to get away from the noisy environment that you find yourself. Make sure you socialize very well. Socialization is very important. Relationship with people are very important, because these are the things that matter. It's when you go out and you have fun with your friends, and you come back.
You liven up.
You liven up, and you come back, you rest, and you see you're tired after dancing and having fun and being happy. You come back and rest. You go to the beach. So we always think that once you are 40, you just restrict ourselves. You don't mingle.
You don't. For young people.
It's just for the young people. No, this is the time you have to take care of ourselves in all aspects. Not just physically, but you have to take care of ourselves emotionally and mentally.
You've hit a point there, the importance of community. You need a good community, and the 40+ Woman is one of such communities.
Yeah, it's really
we organize beach hangouts.
Yeah.
We are going on.
Wow, that's nice.
Yes, we do that. The 40+ Woman hangout.
It's really very
where
important.
We dance. We don't want the young people there. They look at us and say, "What's wrong with these mummies?" I will say, just stay there.
Just stay there.
Stay on your lane.
No, that's the most important part of the body, because once you don't take care of your mental health, you get disorganized.
And you see this women,
disorganizes the system.
They dance because a lot of women are carrying burdens.
A lot of burdens we are carrying.
Burdens. And so I'm inviting you to the next Rejuvenate conference. It's going to be in Dubai.
Wow, that's nice.
In April, yes, we're taking a trip to Dubai. I'm taking the women out.
Wow.
Wherever you are in the world, look out for the information of the 40+ Woman Rejuvenate conference and Bling dinner in Dubai, UAE. So we're going to come back for your last word. We're going to be right back as we wrap up on today's episode of the 40+ Woman. See you soon. Welcome back. And so we've had a wonderful time today on our set. Dr. Izioma Ifeoma has been telling us wonderful things that we need to pay attention to. And I must say a very big thank you
It's a pleasure
for coming today on the set of the 40+ Woman. What are your last words?
My last word is...
woman out there.
Yeah. Well, it's never too late to start. If you're hearing it now, you start. You should know, as we said earlier on, that health is wealth. So we need to take good care of ourselves. We need to go for regular check. We need to do the ones we can do ourselves by simply examining ourselves, looking at our body, know when there is change, and we'll have to go to the appropriate person for intervention, maybe a doctor. Yeah.
Thank you so much for coming.
Thank you very much. It's a pleasure being here. Thanks.
And that's how far we can go on today's episode of the 40+ Woman. Remember to join us on our social media handles. Yes, the 40+ Woman on Instagram. There is a Facebook page called the 40+ Woman. You can join right now and join that awesome community of women of like minds. And you can send us an email on transformations with an S, bj@gmail.com. I remain Busola Jegede, and I look forward to seeing you next time on the 40+ Woman. Bye for now. So that's been our episode today on the 40+ Woman, the importance of health checks. Today we were able to learn all the various risk factors as a 40+ woman. Yes, you've got to pay attention to what you eat. Do not drink, because all these things can affect you as a woman. Don't smoke. The doctor told us about different red flags. If you see a lump in your armpit or your breast, even if it is not painful, you need to intervene. You need to see your doctor. Also, if you find out you're not sleeping well or you're losing weight without any deliberate effort, you're not fasting, you're not on a weight loss, and you find out you're losing weight. She also mentioned to us about the things we should pay attention to. If you're having a foul-smelling vaginal discharge, as a woman, pay attention, especially when you're 40+ and you're post-menopausal. There shouldn't be any form of bleeding at all, not even after you have intimacy. it's important as women that we pay attention and intervene, because a lot of us have labored over our families, and I pray for you that you will be alive and well to reap the fruits of your labor. I'm Busola Jegede, and it's been a wonderful time on the 40+ Woman. You can join any of our social media handles. Look us up on Facebook, 40+ Woman, and on Instagram. Till the next time I come your way, bye for now.
Like a diamond in the rough, you were built up to be tough. You were blessed beyond the curse by the power of the cross. So don't give up on the cause.